the key thing that a lot of people want to know when I do my listening sessions, when I talk to people with various disease advocacy groups, is they just want to know that when we pass this, the next day they're not going to lose their health insurance. That's not going to happen. We pass this law, and the day after, Americans who have insurance aren't going to lose it the day after. We need to have a stable transition to conservative health care reform, and that's what we're doing so that we do not pull the rug out from anybody who is enjoying some kind of coverage they have today. So we want to have a stable transition. And there are a few of the points that I think are really important to just bring peace and mind to Americans who are concerned about all that's going on here, is we want to protect people with pre-existing conditions. We think that that's very important. That has actually been a cornerstone of Republican health care proposals all along. In 2009, I, along with Congressman Devin Nunes, Senator Tom Coburn, Richard Burr, offered the Patient's Choice Act. It was one of our alternatives to Obamacare. Again, like many other Republican alternatives, we had an answer for people with pre-existing conditions, and we have one here. All of our Republican health care alternatives have always agreed with the idea of letting young people stay in their parents' plans until they're 26. We can retain that. What our goal is to do is to provide universal access to quality, affordable health care. Here's another issue with Obamacare. Obamacare is not just the individual market that you think of the Obamacare subsidies. It was also a taking over of the Medicaid program. Here's the problem with Medicaid. Medicaid is a program that is Washington controlled, and it is done in such a way that it stops innovation and experimentation at the state level. It makes it harder for states to customize the Medicaid population and the Medicaid program to work for their particular states. And as a result, more and more doctors just don't take Medicaid. I mean, what good is your coverage if you can't get a doctor? And that is a huge growing problem with Medicaid. Medicaid is also growing at an unsustainable rate, so its ballooning costs are threatening the very viability of the program and our fiscal future. So what we propose is to modernize the Medicaid program. Modernize the Medicaid program along the lines that we as Republicans have been talking about for years. I think it was Ronald Reagan in like the 70s when he was governor who said the states should take over control of Medicaid. Every budget we have had as Republicans, when I was budget chair writing my roadmaps or the path to prosperity, every one of our Republican conservative budgets said, let's get Medicaid control back to the states. In an honor to the principle of federalism, give the states and the governors the freedom and the flexibility to customize the care for their low-income populations how they think needs to occur. Our problems in Wisconsin are a whole lot different than the problems they have in New York or in Nevada or in Utah or California. So we propose more efficient spending, bring the spending on Medicaid to something that is sustainable so it doesn't go bankrupt, and have a safety net for the most vulnerable. Give local control to our states and our governors so that they can craft and customize Medicaid to work for their populations. How do you protect people with pre-existing conditions? I think this is probably one of the most important issues of them all. Here is basically what happens today. Under the current system, we have costs driving up. On the current system, options are going away, as I just described. Choices are fleeting, prices are going up, and under the current system, the fatal conceit of Obamacare is that we're just going to make everybody buy our health insurance at the federal government level. Young and healthy people are going to go into the market and pay for the older, sicker people. So the young, healthy person is going to be made to buy health care, and they're going to pay for the person, who gets breast cancer in her 40s or who gets heart disease in his 50s. So take a look at this chart. The red slice here are what I would call people with pre-existing conditions, people who have real health care problems. The blue is the rest of the people in the individual market. That's the market where people don't get health insurance at their jobs, where they buy it themselves.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.